Sometimes something people really think physio, as we were talking about, physio is just massage.
Right.
Big myth. What do you do different than a massage therapist? Because I know you guys don't massage. I have done physiotherapy from Vinu as well, so I can assure you that she doesn't do just massage.
Right.
But how would you explain to someone new?
So, to be honest with you, we're not even taught massage therapy in our school. So that's why there is registered massage therapy, right?
Yes.
And so if I feel like someone needs massage therapy, I refer them to a registered massage therapist, right? What we can do is often we do some manual therapy, mobilization of the joints, manipulation of the joints, or things like that to change things. But more than anything, I would say what we do is assess the problem. We want to assess the problem, whatever issue they're having, there's a reason for it. Something is going on. So we want to assess the issue, right? And then help with the correction of the issue. And then again, prescribe exercises, corrective exercises, and things like that in order to change that. And I always tell people, it's like I'm helping your body get to where it needs to be, but ultimately it's like teamwork, right? So they have to do their part as well in order to make the bigger change. I can educate, I can give things to do, but if you're not in it together and they don't do it long term, it doesn't really help, right? So that's the thing.
Again, it's you who's working on yourself with a hands-on help with someone else, an expert,
absolutely,
right?
Absolutely.
No, great way to explain that as well. And then a lot of, as we were just to add on to that question as well, because people really just think physio session is just them going into a session,
right? The
passive fix, right? Or they'll go in, do some exercises, but people don't understand that this is the reality where you guys educate the person, you guys do hands-on treatment, you guys do figure out what is the reason, right? A lot of people don't know that physio can do that, and then I'm just saying it out of my experience, amount of people that have come into the clinic and asked me, so physio is just going to make me do some exercises, so I'm just going to get massage.
I think maybe the problem is that we probably need to do a better job at explaining why we give certain exercises. So I find that I talk a lot. I like to educate people because I want to say things just because if they don't understand why they're doing something, they're not going to do.
100%.
If you don't understand why you have to do a certain exercise, you're not going to do. So explaining that, I think, is a huge role. But there's a reason behind giving a certain exercise. Usually. So that's what I say.
I think that's a very big important part for any, even a physiotherapist listening, or even a person who's listening doesn't know anything about physio. I think that's where a lot of physiotherapists are lacking, and that's why people are having a bad experience, because they go into a session but then they come out not knowing why they went into a session or what was the reason behind the session, and then they don't want to go back, right? There are people who don't want to work, move, right? So I heard you talk a lot about your patients as well, that are you willing to do movement, right? Do you like exercising, right? If people are able to help themselves, that's the only time you can help them as well. So no, 100%. I think, as you said, education is a very big thing. Teaching your patients why are they doing what they're doing is the only way to get them.
Empowering them. That's how I think of it. I want to empower them to help them get whatever their goal is. Say their goal is a small goal or a larger goal.
100%.
Whatever it is, helping them get to where they need to be would be my job.
And it builds the comfort for you and your patient, right? And it builds the trust as well. If a person is not able to trust you with their body, I don't think they would be able to work with you at all.